Part B premiums can range anywhere from $284 a person to almost $700 per person for 2026. Your 2024 tax return determines what IRMAA you will pay. If you don't know what you're getting for Social Security, you don't know what your benefits are going to look like at 62, 67, 70, you need to know.
I'm guessing by now, for folks, you probably have noticed your Social Security check changed a bit in January, but with it, so also did your Medicare costs. So while you're seeing more money in your benefits check, you're also seeing more go out for healthcare. So let's start with Social Security updates for 2026. What's information we need to know?
Well, first big thing is we got a 2.8% cost of living increase, and that also happened on federal pensions too. They typically are kind of in sync. 2.8% cost of living increase. 71 million Americans are on Social Security, so they all got a pay raise by 2.8%. But typically those pay raises happen with inflation, right? So if inflation's around that amount, and that's why they got that cost of living adjustment.
Okay.
For the average retiree, this was an increase monthly of about $56 per month. Number two, in Social Security, full retirement age is now 67. So for anyone born in 1960 or later, full retirement age, FRA, has officially reached 67 years old. Claiming before this age will result in a permanent reduction in your monthly benefits. So you want to be careful as to when you choose Social Security. Higher maximum taxable earnings when it comes to Social Security. For those still working, the maximum amount of earnings subject to the Social Security tax increased from $176,000 to $184,500. Finally, a new senior tax deduction. A new federal tax law that just started this year allows seniors 65 and older to claim an additional deduction for singles, $6,000, and for married couples, $12,000 to help offset the taxes typically paid on Social Security benefits.
Of course, those deductions are for people under a certain income threshold. So that's also important to note. This is the whole thing about the retirement plan. We always talk about how everything's connected to each other. It's important to know what works with what. For people who are still working, they're still getting that income, that paycheck, and they are also claiming Social Security benefits. What are earnings limits for 2026?
Yes. I want to be careful here, and a lot of people don't know that if you take Social Security between 62, the earliest, and full retirement age 67, you could have a ding or a discount. And so basically you can earn up to $24,480. That's wages, that's sweat of the brow income, not stock income, not rental income, earned income, up to $24,480 per year. But if you took or take Social Security between 62 and 67 and you're making more than that, then $1 is withheld for every $2 earned above the limit. So essentially 50% of your check is withheld until you hit full retirement age. And for a lot of people, for most people, it doesn't make sense to take Social Security between 62 and 67 if you're making more than $24,480.
Okay.
If you reach full retirement age in 2026, you can earn up to $65,160, so more than that $24,480. Only earnings before your birthday month count. So before $1 is withheld for every $3 earned. Okay. So these are kind of the rules to the game that you need to know.
I was saying when we started, brace yourselves for the details of this. It's a lot. It's a lot.
It is all in the details, actually.
The devil's in the details has never been so true as a conversation around Social Security and Medicare changes, Abe. Speaking of which, let's flip to the other side of this. Of course, the Medicare conversation. What are changes that we need to know about there?
Medicare Part A, hospital deductible, has increased to $1,736 per benefit period, while daily copays for extended hospital and skilled nursing stays have also risen about 3.5%. Number two, Part B premium spike. The standard monthly premium for Medicare Part B rose to $202.90, up from $185 in 2025. This was about a 10% hike that will consume a significant part or portion of a lot of people's Social Security cost of living adjustment. For many, right? I mean, if premium's gone up and you get your pay raise through the COLA, a lot of it's taken away, not taken away, but absorbed through the higher premium. And then the annual deductible for Part B has increased to $283, up from $257. So those are some of the Medicare changes.
Yep. What about IRMAA? First of all, IRMAA. Explain what the acronym stands for. Who pays IRMAA in 2026?
Yeah, she's like that.
She's that aunt.
We might not care that we may not care for.
That we didn't love.
IRMAA. IRMAA stands for Income-Related Monthly Adjustment Amount. So this is essentially a surcharge, an additional premium or charge added to your Medicare Part B and Part D premiums. Part B for everything Part A doesn't cover, Part D for prescriptions. Medicare does look back 2 years to determine your premium. So for 2026, your 2024 tax return determines what IRMAA you will pay.
Which I think is very important for somebody who hasn't quite yet retired, who's thinking about retiring maybe next year. Remember that your IRMAA is affected, not if you're going to retire in 2027, your IRMAA is affected by what you're in 2025, not what you're earning in 2026. That 2-year rule can bite people.
Roth conversions, adding extra income to your picture can affect IRMAA premiums.
Yep.
For individuals, if your 2024 income was $109,000 or less, then you won't have a surcharge on your Medicare Part B premium. For couples, the threshold is $218,000. So here at Abich Financial, a lot of times we'll try to stay under that threshold for people that do not want their Medicare premiums to increase. Once you're above those limits, Part B premiums can range anywhere from $284 a person to almost $700 per person, based on your modified adjusted gross income level. And we do have clients, we do know people that are hitting those high premiums of almost $700 a person, which is $1,400 a couple, which is a lot, but sometimes, you know, you've got to take care of your own plan. Finally, the Part D out-of-pocket cap. The maximum out-of-pocket cap for prescription drugs now under Part D is now $2,100, up from $2,000.
Speaking of Part D and drugs, we've heard news about Medicare now negotiating drug prices. Let's talk about what kicked in that space for 2026.
All right. Well, some of these drug names aren't the easiest to pronounce, but I'll try. Starting this year.
Where did they come up with these names? I want to know who's on the name committee for the medications in America today.
Yeah, we see them on the TV commercials. And,
I know.
But Medicare has begun using newly negotiated lower prices for several high-cost, commonly used drugs. Eliquis, definitely seen their commercials. Jardiance, and I may not be saying these names right. Axarelto, Januvia, Farxiga, Entresto, Enbril, Imbruvica, Stellara, sounds like stevia, and Novolog. So, you know, the Medicare is trying to negotiate on your behalf to lower these prescription drug prices. Savings show up through plan pricing, so check your plan's formulary and copay tier. Prior authorization pilot. There are 6 new pilot programs in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington that require prior authorization for certain medical procedures to help reduce wasteful spending. So those are some new things going on with Medicare.
Yeah, that last one, that's just a test run on a few certain states. So just be wary of that. I guess they'll decide if they want to take things national based on what happens in those states. All right, all that said, lots of numbers, lots of tiny details. What do people need to do? What should we do now?
Yeah, let's try to sum it up. Number one, if you don't know where you're getting for Social Security, you don't know what your benefits are going to look like at 62, 67, 70. You need to know. You need to know when you're putting together your retirement plan. Go to ssa.gov, create a Social Security account, your My Social Security account, and ensure your 2026 COLA notice is correct and that your contact information is up to date. And I would include that your wage history is accurate when you're looking at your latest statements. And believe it or not, we've had clients come in that realize their wage history is an error and that you can get that fixed with the proper records. If you're near an IRMAA threshold, you know, those income limits we just talked about, review your 2024 modified adjusted gross income and consider an SSA 44, that's a form, if you had a qualifying life event that lowered income. Number 3, review your tax filing. If you're 65 years old and older, make sure you or your tax preparer checks the 65 or older box on your 1040 or 1040 SR to trigger the new $6,000 tax deduction. That's pretty important. Audit your prescriptions. Check with your Part D or Medicare Advantage provider to see if any of your medications are part of the new 2026 negotiated price list. Essentially, maybe you've got prescriptions that have come down in price. Finally, document network changes. If you're in a Medicare Advantage plan, save a screenshot or printout of your provider directory. If your doctor was incorrectly listed as in-network, you've got a 3-month window to switch plans.
But you do have time and you do have options. Important to note.
One step at a time. There's a lot there, and that's not something you're going to be able to handle. All these moving parts are not something you're going to be able to handle in one meeting with an advisor, but you can be able to handle them over a series of meetings. And, you know, within 1 year of meeting with a, professional fiduciary retirement planning, over the course of perhaps several meetings, you'd be able to get a lot of these things knocked out and planned for.
So obviously years of experience, a lot of information has come from those years. You took the time to write it all down. Your book, The Retirement Mountain, The 7 Steps to a Long-Lasting Retirement, another resource that you are putting into the hands of folks, just again, trying to educate through information, empower with knowledge and facts like we do every week here on your YouTube channel.
Yeah, there's a lot here in the book. And, Heather, this book was specifically written for people who are really approaching retirement, perhaps early to mid 60s, right before retirement, who need to know all the things that they do need to know to retire successfully with dignity, with confidence. That shift from just going up the mountain here and accumulating to now descending down safely into our retirement. That next 30 years of your life, a new plan should be built. That plan is shift from growth to growth in income, and all the things we're going to do to protect the last 30 to 50 years of work, protect against all these risks. A lot of that's discussed in the book. It's not the end all be all, but it's a guide to help you start thinking about all the things you do need to plan for.
Right. A great place to start by utilizing Abe's book. We want to get you a copy. Anybody who comes into the office for a meeting gets a complimentary copy. We also have links posted in the show notes. You can go to Amazon to buy a copy of the book, buy the Audible version of the book. We also have a link to download a free PDF version of the book if you prefer. Just trying to get you the information so that you can plan for your future, be more successful in that space is what Abe and his team hope to help you with. So links again posted in the show notes. You can also go to our website. Find us anytime at theretirementkey.com.